If you have lower back pain, there are certain exercises to be careful of. Probably one of the biggest is burpees. Now we do use them in class, but we try to modify them, give you a lift if you need to, because what will happen in a burpee is somebody will come down, they'll get to about here, and the back stays straight, but then they come to floor and the back is bent. And then when they stand back up out of the burpee, they bend the other way. And if you remember the pipe cleaner, back and forth and back and forth. So if I'm bending this way, I bend that way, I bend this way, I bend that way. I'm putting a lot of back and forth bending. That lower back is going to probably complain there. So when you're doing a burpee or an exercise like that, we sometimes will give people a platform to use, not necessarily a chair, but sometimes our risers. You bend down, grab a hold here, my back is still maintained straight. Instead of jumping back, I step back so I can be braced through my core the whole time. I step back in and then come up. And so I've been able to hold my core a lot better doing the burpee that way. Other things to watch out for is crunches. So we don't really do a whole lot of crunches in our program, but that curling position. We've already talked about how that rounded forward is a bad lower back thing. So even if you change the position, it's still not so great. So we will do some crunches sometimes, and we're going to be focusing on getting back there and not really coming very far forward. It's not a big forward movement. It's actually more about that lengthening as we go back and bracing as we're back there. But again, if you have a lower back issue, we might find a substitute exercise for you instead of that one. And we don't use those very often anyway. Anything that bends forward, you want to watch out for, especially when you're in that fragile state. So if you still haven't figured it out very well, you don't have your positions down well, make sure when you're bending forward, you may start to do this. So good posture we need. And so if you're not good at it yet, watch out for those. So if there's a bending forward exercise, we can give you a support as you're doing maybe a row or something like that versus the bent over row. So now I want to work you into bent over row because that's going to help strengthen the back really well too. And but we want to make sure we move there without over challenging your ability level. Another exercise, I guess every exercise is to watch out for is anything that causes any bending in the back. So any exercise that makes you bend through there, you're going to try to cut those out or to do it in a way that doesn't cause the bending. Because the less bending, the less aggravation, the more it can settle down, relax, heal, do the stuff it needs to do. And you can start to learn how to use the hips, the shoulders, things like that to do their job so the lower back has to do less. And then finally, the last point on exercise to watch out for really is every exercise, you want to take back the difficulty until you can keep good posture. So if I've got a bicep curl weight and I'm getting it going there and I start to get this rocking motion going on, one, try not to do the rocking motion, but then two, you may have to make it lighter so you can control that. And if we do every exercise where you're focused so much on bracing and protecting in this posture, is that every time you're doing every single exercise, you're strengthening the core. So this becomes your strongest part because you say, I will keep this strong no matter what I'm doing with my limbs. This will stay secure no matter what I do with my limbs. And so at first, you may not be doing a lot. The movements may be very small to start off with, but then as it gets stronger, you can start to move the limbs more and still keep that straight. So it's going to be a slow progression, but eventually you'll get mobility in the limbs, in the hips, in the shoulders, and less in the back, and then you'll have a happy back.